The new Omicron variant of the coronavirus could be more contagious than previous strains, and it's probably already in the U.S. The president's chief medical advisor, Dr. Anthony Fauci, gave that warning to the country Sunday morning, just as tens of millions of Americans returned home after Thanksgiving. The movement could spread the new strain across the country before it's even spotted. CBS News national correspondent Mark Strassmann starts off our coverage.
As a new public health worry, the Omicron variant steeped in mystery, especially its mutations, their resistance to existing vaccines, and whether this new threat already hides in plain sight.
Yes, the variant is probably already here in the U.S. There's lots of travel between South Africa and the U.S.
And just as millions of Americans started feeling more COVID confident, closer to pre-pandemic normal, Thanksgiving travel way up. More than 53 million Americans hit the road. Key to that bounce, improving vaccination rates. Almost 3 in 4 Americans 5 and older have had at least one shot. More than 3 in 5 are fully vaccinated. But, and why is there always a but?
If everybody was vaccinated, we wouldn't be here having a press conference.
Colorado's COVID cases have surged again. Denver's mayor just reintroduced a mask mandate with exemptions for businesses that require vaccines. America's new hotspot, Michigan. Below average in its vaccination rate, Michigan has around 1 in 10 new COVID cases nationally.
We can't have our health systems overwhelmed. We can't afford to go into this winter season with an increase in cases that continues.
The sharpest rise in cases has been in northern states. A drop in temperatures and waning vaccine immunity are contributing causes for the uptick, according to the Institute for Health Metrics and Evaluation at the University of Washington. Starting tomorrow, Massachusetts will curb non-urgent medical procedures. Same in New York State, a medical state of emergency, keeping beds free for an unexpected new wave of COVID patients.
The warning is going out loud and clear today, and I truly hope that the community at large will listen to this because it doesn't have to be this way.
New COVID worries are front and center, Lana, on what's expected to be the busiest travel day of this long weekend as passengers head home from Thanksgiving visits. The TSA screened more than 2.3 million people last weekend. Travel is back. That's twice the number of people it screened on the same day last year.
Very concerning, Mark. Thank you. Joining us now is John Moore. He is a professor of microbiology and immunology at Weill Cornell Medical College in New York City. Dr. Moore, thanks for being here. So how is this variant of the coronavirus different from the other variants that the CDC had previously designated as variants of concern?
Well, the pattern of sequence changes are greater. There is more of them than we've seen before. And the pattern suggests that there may be a degree of resistance to antibodies and therefore an increased ability to break through vaccines. Now, we don't know that for sure at this stage, and it's going to take a few weeks to get that information. But the pattern it raises concerns. That's why it's called a variant of concern. The other major unknown is just how transmissible this variant is. That what we've seen during the pandemic is the most transmissible variant always wins out in a population. So last winter, we saw Alpha outcompete the original 2020 viruses. Then this summer, we saw Delta outcompete Alpha. Both of those are highly transmissible, but Delta won out. Now, is Omicron going to outcompete Delta, or will Delta outcompete Alpha? Will Delta outcompete Omicron? And we just don't know this at this stage. And that's a very important piece of information that we're all waiting for.
So, Dr. Moore, you discussed that the concerns about it potentially being more resistant to vaccines, that it may be more transmissible. What do we know about severity of this variant? Do we have any information? Are we worried that it might be more severe for people who catch it?
We know absolutely nothing about this. I mean, it's clearly causing illnesses and deaths in South Africa, but it's not possible yet to judge the relative severity of those infections. We only heard about this virus on Thursday in the States, so it is really just too early to have all this information. We'd all love to have it. We're all asking each other the same questions, but we just don't have the information yet. But the antibody resistance pattern looks problematic. But if Delta outcompetes Omicron, it won't be relevant because Delta will continue to dominate. And we have this perverse situation where we may be rooting for the devil we know over the devil we don't. I mean, if Delta continues to be the dominant strain, then the antibody resistance pattern of Omicron is something that will just not be relevant. But that might not be the case. We need this information, and we're going to learn it over the next couple of weeks because there's a lot of research now being done worldwide on this new variant.
And in the meantime, the advice that we're getting is still, if you're not fully vaccinated, get fully vaccinated, get boosted if you are fully vaccinated, and still exhibit those measures of caution, including face mask wearing, not gathering with large crowds. But when it comes to whether or not Omicron is present here in the United States, we did hear President Biden's chief medical advisor, Dr. Anthony Fauci, say that it's quite possible that it's already here at this moment. We just haven't identified it yet. Given that, do travel restrictions make much of an impact containing a potential spread? And should the U.S. government be doing anything more than implementing those travel bans?
Well, firstly, people should behave in exactly the same way they've been behaving already. Get vaccinated, behave sensibly, wear masks, social distancing. Nothing changes. These variants are all transmitted exactly the same way. They don't have a power to suddenly jump 20 feet and cut through masks. They're all transmitted the same way. Look, travel bans, we can understand why they're put in place, but there's always a shutting the stable door after the horse is bolted. By the time you realize that you need to do something, the variant's already here to some extent. But the more introductions into the USA that you can prevent through travel restrictions, the better, because it only takes a few super spreader events and then you have a mass surge and a huge outbreak. So it does make sense, and it's difficult to imagine why this wasn't put in place on Saturday morning instead of Monday morning, but there you are. So the travel restrictions do make sense. The variant is almost certainly here. The question is how rapidly and how widely it will spread, and that we will learn about more in the next few weeks. More and more surveillance and sequencing and tracking is being done.
I think people are eager to know more about the Omicron variant, but even before it was identified, COVID-19 cases were rising in several regions across the U.S. Might the timing of this outbreak, Dr. Moore, make it more dangerous?
Well, the reason why infections are climbing across the USA is because they're climbing in unvaccinated people. It's a 10-to-1 ratio of thereabouts. You are much more likely to get infected in this new winter surge, which we're going to see expand over the coming months, just as we did last winter. It's striking unvaccinated people predominantly. So the solution is in people's own hands. Go and get vaccinated. Go and get your third dose if you're eligible for it, which essentially everyone is now. So these are self-inflicted wounds in America. We have the solution to the COVID pandemic in the pharmacies, and people are refusing to take it for bizarre reasons that are politically driven. And that's the root of the problems we face now. So we're going to see another 150,000 dead Americans by the end of January. It's just a numbers game. That's what we saw last winter. That's the kind of numbers we're going to see this winter. But 90 to 95% of those deaths are going to be in unvaccinated people, and that's the American tragedy.
All right, Professor John Moore, thank you for joining, and thank you for all that you do.